I want to welcome everybody in to Coronavirus Inside the Arizona Numbers, where we take a closer look at Arizona's numbers to help you make the best decisions for yourself and your family. Garrett, I always announce the date. I forgot to look. April 9th, Friday, April 9th. I'm out of rhythm and we only get to chat on here once a week now. A lot to get to, a lot of new numbers out that we want to help you better understand as you head into the weekend. I know a lot of people are probably caught off guard by that high case count or higher case count today. We have some explanations for it, and even the baseline number there, we'll talk about that too, because Dr. Kara Chris just wrapping up her meeting where she is updating the media and members of the public as well. So we'll get to it all. And as always, in the comments, you can post your questions, and we'll help you find those numbers and those answers. So, all right, Garrett. So this case number though today was kind of high, and it freaked a lot of people out. Can you help us better understand what happened here?
So I'm going to go through. I'm going to take us right to my internal documentation because of the large numbers. So this is again internal, something that I have. So let me see if I can get this a little closer so it's a little easier to read. So today, the cases that were added today, 1,302. That is the largest number of cases that Arizona has reported since about March 12th. So, of course, when you see that, you think, oh, we've got rising case numbers. What should we do? That's not always the case. So when we go down really quick, I'm going to skip through some of this stuff, show you this page right here. So the 1,300 cases that were added, about half were added to, as you can see, older than March 7th. So most of them, in fact, are even older. They're older. They're past January 17th. And then about 600, so about half and half. So really our case numbers that we added today were closer to about 670. It's not the 1,000. Some of those were administrative. When we look at the zip codes up here, we can see where some of them were added. Like, for example, 85256, that is the Salt River PMAV reservation. That was likely a transfer of data from the Indian Health Services to the AZDHS. 85131 is Eloy, which is there is several correctional facilities as well as CBP detention centers down there. I do not know where the transfer of cases came to, by the way, but those are two major congregate settings, and it's very likely that there was a major transfer from the federal government, it seems, to the state on PCR tests. So, and then 85122 is Casa Grande. I don't have an explanation of that one. And then 85281 is ASU. So those are sort of the major, as you can see, where we added cases this week. And then, of course, there's been some others here and there. But as you can see, a lot of these 85225, 85383, these are tribal zip codes. So again, it sort of follows my hypothesis that it is Indian Health Services and other places, Navajo Department of Health, Hopi Department of Health, those places that actually transfer cases to the state.
So, Garrett, two things I want to talk about here when we're looking at this number. First of all, those older-ish cases, those cases that came from before, it was a lot of cleaning up of the data in there. And that Dr. Chris said one of the things that happened was on some of those, it was reported as coronavirus and not specifically reported as COVID-19. So then they had to go back and say, there are other forms of coronavirus. Was this indeed COVID-19 before we can apply it to these charts? So that explains part of where the mistakes came in. The other question I have for you, then when we deduct those out from the 1302, that leaves us with, I think you said 600 something. Do those 600 represent a rise in week over week when we're looking at these numbers? Do we still have a bit?
Very slight rise week over week right now. So we're going to go to this right here. This is the right here. Sorry, this is the weekly epi curves. So as you can see, this is where we are right now, the 1615, not completed yet. So we're going to really pay attention to this right here. You can see that Arizona has had a very slight, about 3% rise a week in cases from March 14th, from the week of March 14th, which would have started on March 8th. So yes, we are seeing a rise in cases, but it is a very slight rise in cases, and it has not impacted hospitalizations at this point, and in fact, our deaths are still going down, and probably will for some time, because it does take some time for deaths to start to be translated in the system. But we also know a lot of these cases are from younger people, and so we would expect a much lower case fatality rate from younger people getting COVID-19 than vice versa. In fact, 65 plus of the tests that were added today, 65 plus only made up about 5% of all 1,300 tests that were added, which is pretty incredible. How low that number is. It should be closer to, if it was closer in line with the population, it would be closer to 15 to 20%. So as we can see, that is the group that has the highest vaccination rates, and it's definitely impacting the numbers at this point. That group is no longer getting COVID-19 at a major prevalence. It's still happening. It still can happen, but the numbers
not as high.
Are not as you would expect.
I know nationwide, the 65 plus category has been vaccinated at a rate of almost 77%. Does that then reflect here in Arizona? And I want to teach everybody where they can find that on that AZDHS site, because it breaks it down by age group. And that's really helpful. It speaks to exactly what you just said. If we are able to get our older, more vulnerable population vaccinated, then we should see fewer hospitalizations and fewer deaths. As you mentioned, it can happen in any age category, as we've seen, sadly. But if we can really concentrate on that group, and maybe we've even matched or surpassed the nationwide numbers on that. So again, 76%.
Because we only do this on a weekly basis now, I'm going to start from the very, very beginning. This is, as the sign says down there, azdhs.gov. So you come to this right here. This data dashboard is what you click on. This brings you to the dashboard options. And when you want to see the age groups and how they look right now, you go to vaccine prioritization. It's the last button down here. Come down here. It will bring up a new dashboard. I want you to focus on these numbers. Ignore this number right now. The current priority groups, they have not updated the priority groups since they basically allowed everyone to get vaccinations. So that is not a correct number. But this is 76% of Arizona seniors 65 plus are estimated are vaccinated with at least one dose at this point.
Yeah, so that's pretty similar to what we're seeing nationwide.
Yes. About half of the 55-64, and then we get into the 30s and 40s% for the younger demographics. And as we can expect, 15 to 34, this would be a very low number, because at this point, 16 plus has only been available for a while, and you would expect this number to be this low at this point.
Yeah, and we should update that too. A lot of people have been asking about the younger age group, and Pfizer has just asked the FDA for approval for the age group of 12 to 15. So we might have an answer pretty soon. But again, Pfizer just saying that they've completed their research. And in fact, they said the side effects that they saw in kids were not unlike what they were seeing in the age group a little bit older. Sometimes headache, fatigue, pain at the injection site, but that's really it for the kids. And then in the study that they did, they had 18 kids who got COVID-19, but they were in the placebo group. So it was really strong evidence, just like what we were seeing with the older age groups as well.
Yeah.
So,
just there's plenty of, when we talk to doctors about this, we talk to ASU Biodesign, and what Dr. LeBert, who runs that, will say, we already know that kids handle vaccines
very well.
Better. They handle, their systems are just so much better at handling vaccines than older folks. And so, there's an expectation that these studies are going to be just as you're talking right now, where very mild effect on kids.
I know so many people have been asking, though, about that group. All right, Nancy's asking, is Garrett going to keep posting numbers on Twitter in the morning?
Yes, I
do. Yes, I check it frequently rather than going to that site. So
Katie did freak me out just before we get on, because apparently the AZDHS did say that they're changing something on the dashboard, and any change on the dashboard can really mess up what I can do. So I've already reached out to them with my panicky face, hoping that I can still get to what I need to do, so I can spend time fixing whatever it is that they're going to change to. So hopefully Monday I can post numbers. It really depends on what those changes are, though.
Yeah, we'll send pizza to your house if you have
Thank
to
you.
be
I
working
appreciate
there all weekend. Um, People are asking about where they can find a vaccine. There's several vaccine hunter groups, but I want to also tell you about two pop-up events that are happening that have just been announced in Peoria and Scottsdale, so kind of both sides of the valley. Maricopa County Public Health just announced yesterday that there are sites that are going to offer the single-dose Johnson & Johnson vaccine to anyone over 18. So in Peoria, the event's going to be held at the Peoria Sports Complex. That is going on April 16th and April 17th. So Friday and Saturday from 7 in the morning till 3 p.m. And that event is coming to you from the city of Peoria and Albertsons. You've got to make an appointment, and you can do that simply by registering. We've got the info on our website, and we can link it here too. And then the Scottsdale event is going to be over at a shopping center. I can give you the address. It's 1111 275 East Via Linda, but you can also just go to abc15.com/coronavirus. It'll link you there. And so two different places that you can go get the vaccine, and those vaccine hunter groups that you can find online to get a little more information.
A very common one, vaccinefinder.org. This is a very easy, very well done site. And what I will say is just looking at these numbers, and this is just, I just put in 85251, a random zip code in Scottsdale. And I can tell you the number of and these, they check these all day, every day. They scrape the sites, Walgreens, CVS, to see what their stock looks like. And the amount of stock in the pharmacies right now is so much greater than it used to be. If you checked this site last week, you would be lucky to find one, maybe two pharmacies in a 20, 30, 40 mile radius that had any sort of stock. And at this point, it's almost all of them have stock. So
and Garrett, you were just highlighting it there. Costco, we haven't talked about that. Costco has shots now.
Oh, yeah.
So that's a big change for a lot of people. And then also just announced in today, Bashes and Food City are going to be added to that list. I don't know if it's going to show up on there just yet, but Kara Chris just was talking about adding Bashes and Food City. So that's going to get those doses into a lot more neighborhoods to get it to folks out there. And that's going to be the real shift next. Because Garrett, this was about efficiency and getting these shots in arms fast in these massive vaccination sites. And now they're getting ready to move this to convincing any holdouts.
Yeah,
so
I've already seen on Twitter, just by doing my normal daily routine, that now there are doctors' offices that are finally starting to get the vaccine. So yeah, you are right. Now they're moving from that sort of centralized pipeline of having to manage the age groups and manage it to now just basically saying, okay, now we got to get to the stragglers. We're at about 47% of all the adults in Arizona are now vaccinated with at least one dose. So with that, obviously, they want to get this to 70%. That's sort of where their goal is, but they also want to make sure that people go back and get their second dose. And I know that for a lot of people, that's a big deal because, you sit in line for 4 hours at Phoenix Muni or State Farm. Do you really want to do it again? I mean, I'm sure some people say, no, I don't. But now you can get them at pharmacies and whatnot. So that's
right there in the neighborhood. Yeah, and for folks that can't make it over there, don't have access to a car or things like that to get over there. One of the other things is because they're shifting then from just you all come to us to get your vaccine to we invite you to come to us. It does create a need for more messaging and more money spent on messaging and more PSAs and things like that. They did just put together one PSA from the state, so you'll likely start seeing that maybe even on our air. Starting this weekend and on Monday, where they have more leaders in our community talking about getting their vaccine in hopes to encourage others and make others feel comfortable if they were still holding out on that. All right. One of the big things we always talk about is how our hospitalization numbers look. I do want to spend a little time on that. We're going to kind of go fast through all this stuff today because we have a lot to talk about. But how are those numbers doing overall?
So overall, our hospitalization has been very level at sort of a floor for quite some time. And this is good news because in many ways, these numbers are way more important than the case numbers. And especially now, these numbers are very important. I'm going to use the other one because for some reason, as you can see, the AZDHS messed up one day. And now there's a big white line in my graph. And it drives me crazy. Anyway, let me go to the hospital metrics here. So you can see here, we are definitely at a floor that we were at in the middle of October right now. This is inpatient regular hospital visits. We're at about 570. You can see we've been around that number since about late March, sort of holding steady. The ventilator number, I think, let me see if I have that ratio. I usually do a ratio calculation for that. That number is, I don't have it because my ICU page is broken. I'm sorry. The ventilators are at about 66 and the ICU beds are at 149. So that's really quick. Just going to bring out the old calculator. That is 44% on ventilators. That's what that means is that, those 44% of people on ventilators, those are the most sick. Unfortunately, many people that go on ventilator do not make it from COVID-19. That is just a reality of this disease. And so when that number is high, when we were in January, that number of patients on ventilators in the ICU was close to 60%. So right now, coming down to 44%, it is starting to come down, which means people in the ICU are less sick. And so we should also see a corresponding drop in deaths. And that's sort of what everybody wants right now. Obviously, everyone wants to see a continued drops in deaths. There's no question about that.
A sign that we were still very much in it, though, when we passed 17,000 deaths here in Arizona, and that did happen this week. I think that was a kind of eye-opening moment for a lot of people who have maybe mentally sort of moved on from this, maybe fully vaccinated or not thinking about the concerns as much, that we are still losing people, and to hit 17,000, such a huge number, and such a huge loss for the state of Arizona.
At this point, so it took about 36 days to go from 16,000 to 17,000. To put that in perspective, it took, I don't have the numbers on me right now.
At one point, 9 days to go.
At one point, it was 7 days.
Yeah, wow.
It took 7 days to report 1,000 deaths. So now we're at 36 days. So hopefully what we want to see now is it's going to take 64 days to get to 18,000. Right. So obviously COVID-19 reporting is not going to just stop. One day we may actually just stop covering it, but AZDHS is going to continue to at least have these numbers. If they don't do it daily, they're going to eventually move to some other sort of model where they're doing this still on a regular basis. So they're still going to report these numbers. Mm-hmm. So, but right now we're looking at about 60. We're hoping that it's going to take about 60 to 64 days to get to 18,000, and then 128 days. And then it just keeps going like that. That's an exponential decrease. And that's what we want to see right now with these numbers, because that's what we have been seeing. We started, as you said, in January, we started with 7 days. And then it took 8 days, and then 9 days, and then it took 12 days, and then it took 36 days. Right. And that was a massive slowdown in deaths, and we want to see that continue.
So one of the numbers that I don't see falling, and it's probably just because of the ratios and we don't have enough cases anymore, which is a good thing. But the Maricopa County percent of people who ended up hospitalized of the positive COVID tests in there has really stayed around 7% this entire time. What would it take for that to even drop, Garrett? I mean, would it take a ton more cases? But
yeah, so that could drop, and why that could drop but it won't drop that much, by the way. If it does drop, it may drop to like 6%. Yeah. And why that would drop is, and it actually is, the ratio is changing right now, because right now we're seeing 70% of cases that are reported are of the age groups 45 and younger. Mm-hmm. And so there are hospitalizations that come from that, but they're very infrequent, but they do happen. And so that's what's going to be feeding the hospitalization graph. When there's only 5% of the most at-risk community daily being infected by COVID-19, then you get many less hospitalizations from a group that typically gives 50%, I think it was at one point, of people that got COVID-19 in that metric went to the hospital. So that's a very dangerous age group to get COVID-19. And now they're not getting COVID-19 by very many, by much of a percent at this point, only about 5%. Mm-hmm. So we should see those numbers sort of fall because we'll get more cases, but less hospitalizations from those cases because the cases are being driven by a less risk group.
Okay. We're not out of the woods yet in several other places. And I know in Turkey, they just recorded their highest day of cases. In Argentina, same situation, their highest day of cases. We've updated you many times on the situation in Brazil and the high numbers there. Where is the U.S. now ranking in comparison to some of these places that are really, Garrett, in the thick of it as they try to fight through some of these numbers? I know India just had the by far the biggest one-day increase on record for cases as well.
So we're gonna go to 91 DVOC. This is where we typically go when we want to look at the numbers. And so when we look at the United States, cases per day normalized by population, you can see that this is the top 25 data with population over 1 million. United States is under every single one of those. So let's move to the next category, top 50 by data. So we're going to see where the United States, and the United States is again at the lowest ranking of all the 50. So the top 50. So it's not in the top 50. So let's just put an all and see what happens. 198 locations. This is going to be fun. Okay, so it looks like when you talk about 198 countries, the United States is definitely in the bottom tier of COVID-19 cases right now. And you can see that obviously there's a lot of movement here all over the place in some of these cases. Let's just take a look really quick at some of the regions as you were talking about. So let's look at the Americas first. And this is what you're talking about. You see Uruguay's number is just shooting up. It never got to the normalized population numbers of the United States, but you can see it's well past that right now. Chile, Argentina, all these very, very high numbers. Canada's a little lower than us. So let's move to the next group. We'll go to Europe. We'll go back to Africa in a second. I'm sorry. United States is on the lower end of the scale when it comes to Europe. And you see most European countries are sort of getting ready to move in an upward direction right now. In Africa, Africa's numbers are very, very low for the most part. You do have some that are moving at very rapid paces. The Seychelles is a very small population, so they would fluctuate a lot more than some other places. But you can see, for the most part, Africa's numbers are very low. Southeast Asia, very low numbers in Southeast Asia. The Maldives, again, an island, small population, typically a lot of fluctuation there. The Eastern Mediterranean. And you can see this is sort of the Middle East right here. The United States is down for the most part in most, it's on the lower end of these. And then the Western Pacific finish off here. And of the Western Pacific states, the United States is higher than all of them. But these, as you can see, all the Western Pacific states have all been extremely low. This is a group of countries that have dealt with pandemics in the past for decades. And so when it came to COVID-19, these groups of countries knew exactly how to deal with it. And that's why their numbers are extremely low compared to pretty much everywhere else in the world.
Yeah, we were just getting an update too out of the Philippines. My gosh, they had 401 deaths just reported in. That's their highest number. So there are places, kind of dotted all around the world that are still experiencing this. And as I always say, if you have friends
I'm sorry, Katie.
No, I was just going to say, if you have friends or family there, to reach out to them, because a lot of places still locked down and trying to get this thing under control.
I think the UK variant is changing the dynamic in the rest of the world. Now, the United States is in a very good position because we have a very, very high vaccination rate compared to some of the other countries. Let me go back really quick and just highlight Israel. Israel has probably the highest vaccination rate of any country. And let me just make sure. Okay, so now we're gonna. It really doesn't matter which one we pick. We'll just go to Israel though. We can see what their numbers look like. Here it is. And then let's just go to the top 25 by data. Or you know what? I'm going to use, I put bottom 25, didn't I? Let me go to the top 25 with top 50 with populations over 1 million. You can say Israel is lower than all of them. Every single one. You can say are dropping. It's the lowest it's ever been. And this is the country with probably the highest vaccination rates. Now, they are seeing increased numbers of hospitalizations of the younger groups, and they are seeing slightly more severe hospitalizations in those groups based off, again, the UK variant. So we are seeing sort of like people having to struggle with the UK variant, but some places are better equipped than others, and the United States is in a fairly decent position right now to deal with the UK variant.
Yeah, so for perspective, they have 57% vaccinated with their first dose, 52% for their second dose there in Israel. So a ways to go to catch up to that, but it's encouraging to see those kind of numbers there and what they're experiencing. As far as the variants that you were just talking about, the UK variant is now in all 50 states here in the US. And we also reported this week that the California variant has also shown up on the Navajo Nation. So just a few of the changes that we wanted to update you on since we last met a week ago. And then Garrett, there's been all this talk of this double mutant strain and looking at whether it's more dangerous or more concerning at this point. So it's something that they'll continue to study.
Yeah, they're going to have to study those things. That's one of those areas, in my opinion, where science really moves slowly, but journalism doesn't move slowly. Yeah. And so sometimes they go on a collision course. And while, initial reports say that we don't know what this is and it could be a problem, could be more deadly, it's going to take them a while to figure things out.
Yeah.
Until it's really worth
you're
on it. Yeah.
Yeah. You're only as good as your solid data that comes in. And as you have more, you can, make more, I don't know, theories about what's happening there and follow up on those.
Let me show you the variant dashboard for Arizona. So
where can people find this?
This is TGen, actually. This is TGen is the largest sequencing lab in Arizona. I will send this over to producer Carrie so she can look at it. And this is their dashboard that they update daily on what the sequencing and what the variants look like across the state. And so we're gonna go to this because this gives you the actual variants. The variants that are of concern, because obviously there's a lot of things on here. You say, what is this? I don't care. And that's fine. Don't worry about it. B117 is the UK variant. B429 and 427 are the California variants. And then 596 is the South African variants. We do not have, and then here, very, very, very small, right here on the bottom, which you can't see because I can't get to it, is the P2 variant. The Brazilian variant, it's at about 0.2%, very, very small. This B1.2, this is your pretty common COVID-19 variant that's been here for a long time. So, but what people assume is going to happen is B117 is going to push the rest of these down. That's sort of the expectation. As we continue sequencing, B117 will become the dominant and prevalent variant and take out the rest of these. But we don't know yet. So it's just a sequencing game. They're going to keep sequencing it, and we'll see what happens on a regular basis.
Yeah,
it transmits faster. The California variant, I think, is 20%. And the UK variant is 50%. So obviously, when something transmits faster, it gets to the population faster than everybody else, right?
You're going to see the numbers, and that's what they're talking about in the sort of upper Midwest. Is if that's what's happening there. Oh, Tish, you're welcome. Thank you for joining us on here. She writes, thanks, Katie and Garrett, for these updates / data. We're happy to help. A lot to get through on Fridays now that we only meet once a week, but I am so glad that you guys are joining us on here.
I mean, at least we've had several weeks of pretty good news for the most
part. For sure.
I would tell people out there, if you and I go back to daily, that's probably an issue.
Yeah, exactly. Well, for sure.
Daily, then there's a problem. So
for all of us involved.
For all of us.
Vicky's asking if you can put up that TGen address once again. Sure. So Vicky, we won't even pull up your comment. We'll just go ahead and add that on. I know it's a little bit of a long address there, and maybe we can even put it in the comments, producer Carrie.
Just for people, you can Google
Google TGen.
This TGen variant. Those two words, and it'll start coming up. You'll see AZ COVID-19 sequencing dashboard. So if you don't want to follow that exact thing, just TGen variant, and it'll be the third entry
item that comes up. Okay, a couple housekeeping matters real quick. The state sites are moving at several different locations. So you just want to check your email to make sure you don't have an update from the state on your appointment that it's headed indoors. Any of these sites that are moving, which pretty much all of them either have or will, a couple of them moving on 422 and 419. So just check your email to make sure you know where you're going, and now most of them are headed inside. Even the one over at near the zoo, that's inside too. So it's just getting too hot, and they check you in on iPads, and those iPads don't refresh like they should. And if this is about efficiency, they're not able to move everybody through. So just check the location.
Yeah, but again, check the locations in vaccinefinder.org, because instead of having to stand in line at at this point, you can go to Walgreens, and there's a
Yeah.
much better chance that Walgreens is going to have a stock than they did last week. So definitely go there too, not just at the state sites at this point.
Yeah, for sure. Okay, sports, that's back here in Arizona. For those of you who are not in Arizona and are watching, we are having our home opener for baseball here in Arizona happening today. Also this week, the Texas Rangers had their home opener, and they opened to 40,000 fans. And although some were wearing masks, many weren't, and it was a pretty concerning situation. They are not opening this up to that many people here in Arizona today, but they are having fans in person, and that's something that we haven't seen in a very long time. They were one of the first to shut down, Garrett, last year when we were still in spring training, and that was an early sign of what was to come when we started to see closures all around the country. So baseball is back. All right. Do we have some zip code numbers that we can look at for? I know we did the highest zip code movement already, but an overview of your map is so helpful.
Yeah, let's look at some zip codes. So first of all, this is the cases, but I do want to bring something up about the vaccines really quick, because I did some work on vaccines today on the zip codes. So before we get to the actual data for the cases, I want to let you know that I looked at sort of how the minority zip codes were doing in Arizona for vaccination rates. So I basically put everything into several different categories. I put minority zip codes that were 50% minority population, under 50%, over 50% were considered quote unquote white zip codes. And then treatment zip codes, which were zip codes that the AZDHS specifically targeted in a sort of get vaccinated program that were close to sort of downtown Phoenix. And then 85009, which has traditionally had one of the lowest vaccination rates on one of the highest minority populations. And what's really good about this is that what we're seeing right now is pretty much everywhere in Arizona, the vaccination rates have effectively doubled since March 1st, about a 97% increase. The number of zip codes that, let's see, where are we here? I'm looking at my own stuff, and I'm trying to read my numbers at the same time, and that's always fun. So zip codes, minority zip codes actually did better than white zip codes in the last month. So they increased, the white zip codes increased their vaccination rates at about 97%. Minority zip codes were at about 125%. The zip codes that the AZDHS targeted were at about 147%. And then 85009, 180%. So the minority zip codes are increasing at faster rates right now. That being said, their per capita rates of vaccination are still well under what the quote unquote white zip codes are. White zip codes right now at about 320. That's what their vaccination rate is. Minority zip codes at about 211. So there's still a ways to go, but they are increasing faster. So there's sort of a good news, bad news element to this, where, you know, they're not sort of on equal pairing as far as vaccination rates, but some of that, it makes sense a little bit because white zip codes tend to be a bit older, and probably more people were eligible for the vaccination earlier on than some of the minority zip codes. So there are some other factors in play here, but it does seem that that some of these zip codes are doing a very good job trying to catch up right now.
So it's all about equity, of course, and there is money coming from the CDC to sort of send out some of the messaging. And there's already conversation on whether that money is being spent appropriately. When you're looking at your return on investment for the money that they are given to sort of target these groups, how many then are actually showing up and getting vaccinated? Is this money spent in the most appropriate way? I know we've talked about on here for months about how some of they were putting yard signs out and different things like that. Is the messaging getting through? Is it effective? And then are people finally in the last question of that, then showing up to get their vaccination? So it's going to be something that's looked at pretty closely to make sure that the money is indeed well spent.
So let's look at our COVID-19 dashboard here as far as the Maricopa County zip codes. And obviously they've changed the coloring a little bit. If you remember back in December, this was all red. There was no deviation in color. Now we have 4 different colors. We have blue for very little transmission. We've got yellow for moderate transmission. We've got orange, I've got the hiccups, substantial transmission, and red for high transmission. And our high transmission zip codes, anything over 100 per capita, there's a few of them on here. You can see we still have some in the West Valley. Most of them are just just over 100. Some of them, in fact, are not even over 100, but they have just a higher positivity rate of over 10%. So 85305. Here's one right here, 85007 at 111. We have one in the East Valley right here at a 10% positivity rate, but a 59% or 59 capita. ASU's at 111. So you can see a couple of these reds. There is this one popped up. This is brand new. It's a percent positivity rate at 10%. There's always going to be fluctuation in these rural zip codes, but for the most part, definitely we're seeing obviously less transmission in this side of the valley, more transmission on the east side of the valley. More on the east, less on the west. I messed that up again. More on the west, less on the east, especially the northeast. And that, of course, if you look at the sort of socioeconomic conditions of the valley, that's, this is a wealthier area of Maricopa County than this is. And so because we've seen all along that socioeconomic conditions can have an effect on the transmission rates, that's obviously what we're seeing here.
Yeah. So Garrett, since we don't get to look at this map all the time, do you know, are those areas in red coming down off their high, or are they climbing back up? Did they dip down to orange and yellow, and now they're...
What's interesting right now is a lot of these they're not red. They weren't red last week. Now they're red. There's sort of a fluctuation point happening right now where there's little pop-ups. You know what I mean? So there'll be one zip code that was in the yellow, and then you said it's this percent positivity pops to 10%, and so it flares up to red, and the next week it'll be back down to orange. So we're seeing small little clusters here and there pop up and go down, and little flare-ups, but we're not seeing, as you can see, there is, with the exception of this clustering of orange, where there is just a lot of congruency. When you don't have congruency in an area, there's an expectation that there's fluctuation. So
yeah.
So it's obvious that Avondale, Buckeye, that COVID-19 is essentially at substantial transmission in this entire region. In the East Valley, for the most part, substantial transmission in the East Valley, but there is some fluctuation in the numbers. And then in the north side, moderate transmission up here. And the blue, like I said, the blue is such a small area, it's difficult to tell what's going on anyway. Yeah, with the exception, I guess this is Fountain Hill. Oh, no, that's even Fort McDowell. So that's sort of what you're looking at. So that's the way I would break this down.
Okay. And people can view this map, or is this your internal map?
No, this is something you can view. It's at gas.maricopa.gov/COVID. Oh, we have it up /schools. So this is an available map. You can also go by school districts. We'll look at the unifieds really quick. You can see the unifieds for the most part are still in yellow, with the exception of Fountain Hills, which is in moderate. The high school districts are all in orange, which, as we just talked about with the West Valley, that makes sense. The elementary school districts will also be, for the most part, you can see some blue. Here's some very rural areas. And then we have a little bit of yellow and some red here and there. Wilson Elementary School being at 127, and Riverside Elementary School District being just above 10% positivity rate.
So we want to remind folks those are updated at the end of the week. If you want to continue to check those out, both by zip code, by city, and also as Garrett illustrated there by school district. You know, we were just talking baseball, and now we're getting an update in from our producer that nearly an entire NHL roster has tested positive for COVID-19. So Vancouver's dealing with this. 25 members of the team there, 18 active roster members, three of the squad players, and 4 staffers, all testing positive. I can't believe they are not vaccinated yet to be in a team setting like that. I think that I'm surprised.
You would think so. Because I know, especially if it is a B117 variant, my understanding is the vaccinations work just fine against the B117 variant.
Yeah.
And so, because it's not the South African variant, it's not the Brazilian variant, where there is some, there's very good evidence saying that it can pass some of our vaccinations. It can kind of trick our body into giving us COVID-19 again. But B117 isn't one of those. So people who are vaccinated should not have a major concern against B117. Yeah,
it's going to be really interesting when we hear a little bit more. But again, 25 members of the team. I just think it's incredible. I mean,
I think so.
As somebody who's waited their whole life to play at that level, I would think the first thing they would want to do is go get vaccinated so that they're not missing any games or any playing time. So it's surprising, but we'll keep you updated on that. Okay, we are getting short on time here, Garrett. With these higher case numbers, and again, for those of you who missed the beginning, we kind of talked about how over 1,000 cases coming in today, but those being split between older cases that have just been kind of cleared up a little bit. I explained all that before. If you missed any of it, just roll to the beginning of this conversation when we're done. Cleaning up those files, but then also the number of about 600 coming just in. Those are fresh cases. So on the heels of that, what are you going to continue to watch closely this weekend?
So obviously, we're going to keep watching the case numbers to make sure that they are sort of in this same leveling off that we've been. We have not detected a surge yet. We haven't detected, in fact, a significant increase of any case. It's only been about a 3% increase. We are looking at those. We want to see if there continues to be a divergence between the case numbers and the hospitalizations. What we expect to see right now is a slight increase in cases, coupled with a decrease or leveling off of hospitalizations and a continued decrease in deaths. That is sort of what we're looking at right now. And that's what the way forward should be at this point. And we'll also, of course, be paying attention to the vaccination rates to see if they continue to increase. We're hitting record numbers of vaccinations on a daily basis right now. And hopefully that continues.
Wait, we had like 74,000 just in one day yesterday.
Mm-hmm.
Wild. Yeah. So we're still in that efficiency phase. And as we mentioned, moving into that that targeted messaging phase to try to get any holdouts in. And actually this shift in phases it appears to be hitting a little earlier than expected. They expect that full shift to happen at the end of April, when they really have to start pushing that message instead of just inviting people to come get their vaccination. Outside of that, Garrett, we talked about some changes that could possibly be coming to that dashboard as early as Monday. So just an early heads up, if you're checking on that site, it might look a little different on Monday. We'll work to get some other intel. Garrett hopes not.
I'm super nervous now.
I know. We'll work to get some other intel on how much that's going to change, or what that front-facing website is going to look like. So if some of your favorite things, favorite numbers to check on are going to be moving, then we'll, of course, let you know where you can find that information and talk to you about that next week. Globally, now we are we have 134 million cases globally, and we are now approaching 3 million lives lost. We're at 2.9 million people lost around the world to this virus. So just some incredible numbers. And as I mentioned, every single time as we talk about the data and we talk about the numbers here, we never forget that there are real families and real lives affected by this, and especially the 17,000 Arizonans. Many stories that we've told here on ABC 15 News of those who have suffered disproportionate loss. So we remember those families as we close here today. You can find all of our coronavirus reporting on abc15.com/coronavirus. As I mentioned, when we're not here with you on the daily as we used to be, you can find our reporting right there. And any updates on our schools at abc15.com/schools. A lot of discussion about how to best protect our kids as well, and some changes there, and a lot of reporting always on that. Our newscasts are coming up at 4, 5, 6, 10 p.m. and also over on CW 61 at 9 p.m. Kimberly, thank you. We hope you have a great weekend too. And let's see what else I didn't forget. Garrett's Twitter account. Send pizza for him this weekend if he's working overtime. His Twitter account is at Garrett_Archer. Mine is at Katie Rammel, and you can also find me on Facebook at facebook.com/news from Katie. So did you get your second shot, Garrett? Are you done? Are you 2 weeks beyond?
I was a J&J, so
you were one and done.
One and done.
And any side effects with that, or?
I was a bit tired for a couple days, but like really a bit tired. And
yeah,
that was pretty much it. I had a tiny little headache the first day that it was like sort of teasing me, but other than that, no,
you were okay.
Yeah. Mm-hmm.
Yeah, that's pretty much what's been reported is, as we talked about, headache, fatigue, pain at the injection site, but really not much more than that.
That's like someone punched me in the arm, and whatever,
Yeah, and not like you couldn't move it, just
uncomfortable. It kind of hurts.
Yeah. All right. Well, that'll wrap it up for us. We'll be back here with you very soon and keeping you updated on all of these numbers. In the meantime,